This is Patrick Cawley with Keystone Elder Law. This is Keynotes, a series of conversations about issues affecting the elderly, people with special needs, and veterans of the armed forces. I am joined today by Scott Dyrek, who is an expert in Medicare and will explain the details of Medicare coverage. Scott, I will let you talk about your organization and how clients come to see you. We are recording this in the spring of 2020 during an interesting time, and I'm sure there's a lot going on with Medicare. For example, the $2 trillion stimulus package that was just signed into law expanded Medicare a little bit in the wake of COVID-19, so it covers more in the way of telemedicine and expands Medicare payments for COVID-19 related hospital stays and durable medical equipment. But we'll at least cover the basics of Medicare and some options to pay for services that are not covered under traditional Medicare. And I'm really thrilled to have you because you can go into much greater detail on this than I can. So thank you for joining me.
Well, thank you very much, Patrick. We certainly appreciate the opportunity to be here and cover a topic that's confusing to many people. So especially coming into turning 65 and coming on to Medicare, or if they're continuing working and what do they do. So a little bit about us. Our company is AIA Alera Group. We're a national company. We're located in Mechanicsburg, Pennsylvania is where our offices are. We do group benefits, property and casualty, and what I specialize is in Medicare side of things and individual health, but primarily Medicare. And it is a very confusing time for people when they're turning 65 coming onto Medicare, and we try to make it very simple for them. We have a very simple model. We licensed with the majority of carriers, so we're not biased toward a particular carrier. We sit and try to explain everyone's options so someone can make an educated decision about what's best for them.
And I think people have maybe a general sense of what Medicare is, especially if they're approaching age 65. They know that that's going to be their health insurance. They probably know or have heard of Part A, which focuses on short-term hospital stays, short-term skilled nursing for rehab from an injury or a fall or an illness, or some home health care. They might have a sense that there's Part A for that, Part B for their doctor visits. They may or may not have heard of Part D for prescription drug coverage. I think there's probably a drop-off in understanding then when it comes to what's included under Part C. But if somebody comes into you to talk Medicare, what do you tell them about these basics beyond just that's the structure of it?
Oh, correct. Yeah. So we start with, Medicare, which, as you already mentioned, started in 1965. It came out with just Part A and Part B. You covered some of the base Part A and B. Part A is free if you've worked 10 years, 40 quarters. Part B, there's a premium for. What a lot of people don't know is a premium is also income-based. So majority of people, if you're a single person, you make $87,000 a year or less, or married, it's $174,000 or less, you'll pay $144.60 right now. But if you're in above those amounts, there's 5 different levels based on your income. You'll pay not only more for Part B, but also Part D prescription drugs. So first off, some people aren't aware of that side. But a lot of people come onto Medicare and think, okay, this is great, I'm all set with Medicare. But as you mentioned earlier, also Medicare has a lot of cost sharing with it that people are not aware of. For example, Part A is a $1,408 deductible. So if you God forbid you go to the hospital, the first $1,408 is on you. But Part A only covers services in a hospital and room and board. It does not cover doctors or anybody that treats you in a hospital. That's covered under Part B, which you pay the premium for. That carries $198 annual deductible and a 20% coinsurance. So if you go to the hospital, you're paying 20% of the surgeon, anesthesiologist, your family doctor comes in and says, hello, how you feeling? And bills Medicare, you're paying 20% of that conversation. And there's no max amount of pocket. So there's no limit. You're exposed to 20% of all your care. And that's where a lot of people really didn't understand that and have actually gotten financial trouble based on that. So because of all those costs, you have some options to help offset those costs. The first one's a Medicare Supplement plan. And supplement plans go back to 1965 when Medicare first started. That's option number one. The newer options are Medicare Advantage, which is now Part C under Medicare, and prescription drugs, which is Part D under Medicare. These two started in their current form in 2006. So prior to 2006, there was no drug coverage with Medicare. You had to pay everything out of pocket. But since then, you now have these options. And this is where most people get confused on what these differences are. And so, again, what I try to do is we explain all these options. There isn't one that's better than another. It's truly an individual based on what the individual's goals are.
I think that that's a great overview, and you're right that people end up being surprised by what's covered and what's not. For example, at our practice, mostly what we deal with is people who are planning for long-term care. So maybe they had a hospital stay and then went to a skilled nursing facility to rehab. And of course, there's Medicare coverage there for a maximum of 100 days. And usually people don't get the full 100 days. It really depends on their progress and when they start to plateau in their physical therapy or occupational therapy.
Right.
But people tend to be very surprised that if they have to stay for the long haul, if there's dementia, if there's, if they're looking at a long-term stay in a skilled nursing facility, then they come to us and talk about a specific type of long-term care Medicaid, and we can help them with protecting family assets and helping them to become qualified. So, but you're talking about in I think so far with A and B, the much more acute. Right now, you need to go in for care, and this is where Medicaid play.
Yes, absolutely.
So, okay, so with A and B being traditional Medicare, I think you've covered it. I mean, if the person has to generally be Social Security eligible, so they get to age 65, it doesn't happen automatically. They do have to sign up for traditional Medicare unless they're receiving Social Security benefits, which there's actually an advantage to putting that off.
Correct. This is a place we get a lot of questions and a lot of people trip up. And so when a person's turning 65, when you can enroll, you have a 7-month window, 3 months before the month of your birth, the month of your birth, and 3 months after. That's Medicare's window to enroll in Medicare. If you wait past that window and you have no other coverage, you can be penalized for coming into Medicare under Part B and Part D prescription drugs later. Now, here's where people trip up. A lot of more people are working past the age 65 than before. So a lot of people are saying, okay, I want to work past 65. I want to stay in my company plan, but do I need to sign up Medicare to avoid the penalties? Well, this may or may not be true. And this is where the confusion comes in. If you work for an employer with less than 20 employees, then you must get Medicare A and B. If you do not get it during that 7-month window, you will be penalized later because Medicare is primary to the work coverage. However, if you work for a company with more than 20 employees or 20 employees or more, you can stay on the company plans, not take Medicare, and whenever you want to leave the company or leave the company plan, you can get a special election to pick up Medicare with no penalties. So I've met a lot of people who have, not that long ago, I just talked to somebody who worked 10 years. He was paying the Part B premium and his work coverage premium and didn't need both. But he did it because he thought he was avoiding a penalty. And that's again, where a lot of confusion is. Now, if you're drawing Social Security when you're turning 65, Medicare is going to automatically send you Part A and Part B. Now, you can defer Part B. You don't have to take Part B if you wanted to continue working and stay in your company plan, but you must take Part A. You have no choice when you're drawing Social Security. So then that card will come automatically to you. But if you're not drawing, then you're correct. You have to go contact Social Security and enroll through there.
So a lot of what you do, I sense, is that you help people identify what's going to be covered, assuming they understand their eligibility, which you just went through, the penalties for not enrolling when they should, and so forth. Inevitably, they figure out that there are things that are not covered, maybe dental, vision, maybe some hearing services. So I assume you go over that with them. What else would cause somebody to look into some other option like Medigap or a Medicare Advantage plan?
Well, certainly, since you're exposed to those potential costs under Medicare, most people do want something to go along with it, to at least to understand. So there then, between the differences between a Medigap or Medicare Supplement and Medicare Advantage, a Medicare Supplement plan are standardized plans by the federal government, and they letter them plans A through Plan N. It's alphabet soup, but the government likes to letter everything. So Plan A is and Plan B, Plan A, Plan B, all the way through Plan N. There's a bunch of letters missing. They've discontinued some through the years, but each of these plan letters cover various amounts of what Medicare would make you pay for. These are sold through private insurance companies. So the benefits are standardized by the federal government, but the private insurance companies sell them. But it's standardized. So Plan A is a Plan A. It doesn't matter what carrier you buy it from, you're buying the same thing. But they're free to charge whatever they want. And this is what separates the carriers. And there's lots of different carriers selling these. So it's usually price that separates those. When you get a supplement plan, by law, they cannot include prescription drugs. So you must then purchase a separate standalone prescription drug plan to go with it. Again, if you do not, some people say, well, I'm taking medications, why do I need to add a drug plan? Well, because if you don't, you get it later, you'll be penalized for not having one. So even if you're not taking prescription drugs, you definitely want to look at getting a drug plan to go with it. Now, Medicare Advantage plans, which again, in the current form started in 2006, and they're completely different. The whole concept behind a Medicare Advantage plan, and again, this is Part C now under Medicare, they actually created another part for this, is Medicare or the government wanted to slow the cost of Medicare down. The number one cost of Medicare has been fraud, waste, and abuse. And they thought, well, how can we mitigate these costs? What can we do? And the reason why fraud, waste, and abuse is so high, because it's easy to defraud Medicare. A doctor could bill for patients they never saw, and it's hard for Medicare to check because they've got only a few processing claim centers throughout the country. It's hard to, they're not close to the problem or the situation. And don't get me wrong, it's not every doctor being crook. That's actually the biggest part of it is waste, where doctors, they might order tests that might not be necessary, or it's not even purposefully, it's just there's a lot of waste in the system. So they thought, well, what if we pay private insurance companies to manage Medicare? They're already in every state, in every area. They have networks of doctors. They have claim centers. They're a lot closer to it. They can catch this stuff better than we can. So they came up with a formula or an algorithm to pay private insurance companies to manage people's Medicare. And that's all it is. You're not leaving Medicare. It's just that now you're buying a plan from a private insurance company that is being paid by Medicare. They're under contract from Medicare, and they're only 1-year contracts. So that's why you have that enrollment period from October 15th to December 7th. That's your window to pick a plan for the next year, because each plan year is only 1-year contract. And the deck reshuffles each year. So whatever your plan covered 1 year, they could totally change for the next. So this is something you can't just buy and forget. You've got to analyze it each year, which is again what we do for people. So the difference is that's where a lot of people have seen zero premiums. You get a plan that doesn't cost you anything a month, and people think, well, sounds too good to be true. Well, no, it isn't. It's subsidized. They're getting money from Medicare just by enrolling you. And like all insurance, some people use it, some people don't. The ones that aren't using much services, their money is going to help pay for the ones that are. Now, I won't go into all the details, but there's a lot of strings with this. Medicare just doesn't hand them money free and clear. There's a lot of strings. But anyway, so the benefit is now, unlike a supplement where you're paying a higher premium, so yes, you might have little or no co-payments as when you go to the doctors, but you're paying a higher premium, as opposed to I could have a zero premium. Now I'm just paying as I'm using services. So Medicare Advantage, pardon the pun, the biggest advantage is most people will save money over time. Now, again, it's insurance. There's no one has a crystal ball. No one can predict exactly. But what we try to do is explain everyone's options and let each person make a decision. But they're making an educated decision about what's best for them.
Wow. So, okay. So we've gone through A and B, and just to be clear, you have to enroll in A and B before you start talking about a Medicare Advantage plan.
Correct. Or supplement plan. You must have A and B for both of those. Correct.
So can you give me maybe some examples, obviously not mentioning names, but somebody who comes in and what their circumstances are and how you would guide them beyond A and B to either a supplement or a Medicaid Advantage plan?
Absolutely.
Or a Medicare Advantage plan, excuse me.
Absolutely. No. So again, as I just went through, we explained the differences just like I'm doing now. And then I usually actually will give some situational stories. So I'll give you one here that I think helps some make sense to people or can sum things up. So I have a client, again, I'm not going to mention names, but the one spouse went with a supplement plan, the other one with the Medicare Advantage plan. This was in 2006 is when they started on both of these. In 2016, the husband unfortunately developed cancer. I got a call from his daughter. She was all upset. He had a little over $4,000 bills with a Medicare Advantage plan. It was in the zero premium. And she said, when my mother went through her cancer, she never had to pay anything out of pocket. I understand how does this insurance work? And after I calmed her down, I said, look, your dad has a Medicare Advantage plan. He's paid zero premium. This is the first money he's had to spend. I went back and added it up. Her mother spent over $19,000 in premiums in 10 years. So when you look at it from that standpoint, you say, okay, so he's ahead of the game, at least from what he was spending. But now knowing that he's battling cancer, for that next year, we switched to a plan at the time that was $50 a month with a maximum out of pocket of $3,000. So his worst case, no matter what he dealt with, was $3,000, which 2017, as it actually turned out, he didn't even hit the maximum, got close, but then he got cancer free and he's back to a zero plan. So with Medicare Advantage, you can change each year after year. They're guaranteed issue. Medicare Advantage, they only ask one question. That's if you suffer from end-stage renal disease. And if, God forbid, you had that, it just means you have to stay with a carrier. You can pick any plan, but you can't leave that carrier. But in that case, so, you know, if you give them the time of what, you know, she was spending a premium versus what he was paying, even battling something like that, he still was over a period of time spending less money. But, you know, again, there is no right or wrong here. If some people just are more comfortable, you don't have to worry about copays, you don't have to worry about the what ifs, then the supplement plans are great. So there is no, again, right or wrong, but each spouse went in a different direction and it served them differently, and they were both happy. So
I think it's really an important point to bring up. 2 points, actually. The one is that there is an annual enrollment period where you can change. You're not locked in forever with what the options that you're describing. And the second point is that you really, it's really an individual decision, and it's really based on a person's circumstances, and not only that initial choice, but what you do each enrollment period, whether you stick with it, whether you change things up. So I think that that's really, I mean, what I'm hearing is that's what you do, is you look at particular circumstances.
Absolutely. Most people pick plans based on what a friend or relative tells them. And understandable, they're trying to find someone they can trust and, hey, what do you have? But this is truly individual. Not everyone takes the same medications. That's usually where we start, certainly for Medicare Advantage plans. That's one of the big things that separates them. Like, for example, in Cumberland County, where we are, there's over 50 different Medicare Advantage plans. So how do you pick which one? We start with prescriptions. I equate it to a puzzle. You have prescriptions, and you have doctors and what networks. Then do you travel? Do you not travel? Do you travel internationally? Which, of course, no one's doing now. But, you know, all these factor into what the best plan for a person is. Do you have a summer home? Do you have or winter home? Or do you have, I mean, all these can play a role. So that's why there's no one size fits all. And because these plans change every year, I mean, the advantage is, again, pardon the pun, you're not deciding your health the rest of your life. You're just picking 1 year at a time. What do I need? And if your health situation changes, you have the benefit of being able to change plans accordingly to fit that. So your goal with that, though, is over time to potentially save money, as opposed to just paying supplement premiums. And those benefits are locked. They're set. So, like, for example, this is another, I'm going to come back to supplements because this is a lot of confusion. There's, in the different plans, Plan F was always at one of the highest levels. It covered everything. You had no out-of-pocket costs if you had a Plan F. For 2020, Medicare discontinued Plan F and Plan C, which was similar. So now the highest level you can get is a Plan G, which is just like F, except you have to pay the Part B deductible, which right now is $198. So in other words, you have to pay the first $198 of your care. Then after that, as long as it's a Medicare covered service, you don't have any costs. You still do with prescriptions, but I'm talking just medical. So with that type of plan, you know, people say, okay, this is where it doesn't cost me anything. Well, yeah, it does. You're spending a monthly premium whether you go to the doctors or not on that. But again, some people are comfortable with that. And that's, so say you're paying $150 a month with a drug plan. I'm just rounding numbers. That's $1,800 a year whether you go to the doctors or not, versus a Medicare Advantage plan where if I'm in a zero copay and I'm paying $5 or $10 at a primary care doctor, or $30 or $35 or $40 at a specialist, would I spend $1,800 worth of copays in a year? Well, if you're relatively healthy, for most people, no. But this is, again, what we lay out so somebody can make a decision of what best suits them. I'm not trying to promote one's better than another. I've had multimillionaires go with zero premium plans, and I've had people barely afford it prefer a supplement plan. So it's truly individual.
That's great. What a great explanation. And, you know, I think that you've made some references to Part D prescription drugs, but I don't know that we've talked about that in any great detail. Is there anything else about Part D that people should understand?
Yes. So one of the things that we do, and I guess I also didn't mention. So with clients, we will either meet with them in their home. We put on seminars, as you mentioned earlier. We'd be happy to do one with Keystone. We're very excited to do one where that. And we do some for the public. We do some for organizations, employers, if they want to, for their employees, us to come in and do a presentation, explain. We're doing a basic outline, but we'll go into a little bit more detail than this on Medicare, how it works, and give people all these options. Oh, go ahead. I'm sorry.
No, that's okay. What else would you want people to know about Part D
Oh, I'm
prescription
sorry.
drugs? Since that
Part D
really
prescription.
does, I think historically, it's interesting. You said you start the conversation often with a client by looking at prescriptions, because that was such a cost driver for so long for people. And I'm not sure if that's improved or if it's getting worse. But what do
Well,
people need
it's
to know about Part
a,
D?
a little of both, but yeah. So the reason why is because those, of course, are known costs. If someone's taking prescriptions, of course, we know you're spending money with that. So now with prescription drugs, in our presentations, we do go through and explain, and I'm sure you've heard of the coverage gap and donut hole and how the prescription drug coverage works. I don't know if you want me to go through that here. It's without charts. It's might be a little confusing just me discussing it, but basically explain how the prescription drug coverage works. Basically, there is a number that you reach in 2020. It's $4,020. If all your prescriptions add up to that number, you'll hit a coverage gap, which now your costs are going to go up. So we do analysis for people, and Medicare.gov, which is a great resource, but you can put your prescriptions in. It will tell us, each carrier, what you're going to spend. If you'd hit that coverage gap or donut hole, when you'd hit it. Of course, if you're taking mostly generics, you're not going to hit it. And that's really what separates the carriers. So we explain how all that works, and we do analysis. And this is something you must do each year, because just because they cover prescriptions one way one year does not mean they're going to cover it the same way next year. So for all of our clients, every year we touch base in October, and it starts with a phone call, or if need be in person, and we will run prescriptions and find out what the plans, if their plans still will suit them for next year, or if they have any other health issues that they need to change plans, and this is what we'll do.
Wow. And there's just so many moving parts, it seems. And that's why I think maintaining a constant finger on the pulse of a client's circumstances must be so important. But you've gone through all of the general structure and the eligibility and what's covered and what's not, and the way to sort of pull different levers to make sure that each person is getting the right coverage. And you also said that clients come into you, but you also go out and do public education, which is wonderful.
Yes.
How can people, whether they are individuals and interested in becoming a client, or if it's an employer who wants to offer this education to their employees, how can people get in touch with you?
A couple different ways. Of course, our phone number, and my direct number is 717-574-1576. That is a direct line to me on my cell phone, which all my clients have. I also through email. It's do you want me to give that to? It's sdardick@aiabrg.com. I'll say it again, sdardick, DARDICK @aiabrg.com. So welcome to email me with any questions or anything, and contact. Now, Medicare has very strict marketing rules. A lot of people aren't aware of this. There's no cold calling allowed. So in other words, if you told me right now, hey, Scott, this sounds great, I have a friend or relative, here's their number, I cannot call them. They must reach out to me first. That's why and anyone turning 65 will contest to this, that you get bombarded in the mail with all kinds of stuff, because that's all anyone's allowed to do, is they're allowed to mail you stuff. And all the stuff you get in the mail is really designed for you to either call, go online, click something, and what you're really doing is giving permission to call you. And that's when the phone calls start. Some people will unfortunately get calls even without permission, and they risk losing their licenses. But Medicare is very strict on that. So if anyone does have anybody, they can't say, hey, Scott, here's their number, call them. It must be the person, must contact me directly.
Well, the nice thing about this series of conversations that I'm having with people is that we're not trying to sell anything. It's just, this is what we find interesting. We see the benefit that it has for people we serve, our clients. And I'm just thrilled that you can bring all of this knowledge to the people who follow Keystone Elder Law's social media and so forth, because there's so much to learn, and it can quickly become discouraging, I think, for people who feel like they're having to learn Greek as they approach 65.
You're absolutely correct. And this, as I said, started off with, this is a very confusing, and it's very difficult to do this yourself. It really is. And I should say, it's very important that something you just mentioned, that our services are free. We do not charge anything. We are paid by a carrier if they enroll through us. But honestly, I've helped many people to get things. If I'm not licensed with it, I will truly help somebody do what's best for them. Our goal and mission has been to educate people and truly just help people.
Well, we thank you, Scott, for joining us today. This has been jam-packed with helpful information, and I will post the way to contact Scott at AIA for people who view the video. Thank you to everybody who is watching.